What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting a little bit about costochondritis. Let's get into it. What is costochondritis? Basically, it's an inflammation of the costal cartilage area of your ribs. What is the costal cartilage? It's basically a piece of connective tissue that connects the bones of your rib to your sternum, and this region can become irritated or inflamed for various reasons. One of the reasons can be if you've been sick and you've been coughing a lot over the last few days, that increase in load is going to put a lot of pressure around those areas, because when you're coughing a lot, you're generating a lot of intra-abdominal pressure and intrathoracic pressure, and as a result, that cartilage and the muscles and ligaments around that area can get irritated and inflamed. The other thing to be mindful of with costochondritis is it's a diagnosis of exclusion. So anytime somebody is coming in with any sort of chest pain, we're always looking to try to rule out any other more sinister pathologies, things like collapsed lung or pneumothorax, hemothorax, rib fractures, sternal fractures, just things that are a little bit more serious. And that's where you're going to get other sort of symptoms that don't really present as somebody who's coming in with costochondritis or an inflammation to that area. We're looking for shortness of breath, fever, chills, mechanism of injury or what happened to cause it. We're looking for changes in lab values, or if you have lab values available, or changes in your vital signs. If somebody has costochondritis, they're going to have a normal x-ray, they're going to have normal blood work, normal vital signs, and they're not going to have some of those symptoms of some of the more sinister pathology. So super important that we rule out any of those sinister pathologies, and then we diagnose it primarily by palpation. So we're looking to palpate that costal cartilage region, which is again kind of closer towards your sternum region where that attaches, and we're going down, and usually affects about the second to fifth rib, so kind of that mid upper chest region area, and it can be reproduced with deep breathing, it can be reproduced with coughing, things that are generating more of that pressure. And what can be done about it is, because it's an inflammatory condition, talking to your family physician about having some anti-inflammatories if you're appropriate for that, is one of the go-tos, in addition to exercises, different forms of exercise and stretches and mobility meant to get some more blood flow to that region to help stimulate healing. So things like thoracic extension exercises, things like thoracic rotation exercise, and just trying to get some of that movement back and slowly building up your tolerance, starting low and then progressing based on what you can handle is key. With any sort of inflammation or injury, we're looking at recovery timelines from 1 to 2 weeks up to 6 weeks. But again, it really just depends on the individual and their healing. So there you have it. Just to recap, costochondritis is basically a diagnosis of exclusion. So it's a diagnosis made after other diagnoses have been ruled out, more sinister or red flag finding. Most investigations such as x-rays, lab work, vital signs, ECGs are all going to be normal, and it's mainly diagnosed by palpation in that region closer to the sternum area. It generally comes on after a period of too much too soon, such as coughing too much if you've been sick, and pain is more present on deep inhalation, and it varies from person to person. And it's an inflammatory condition that can get better with anti-inflammatories if appropriate, in addition to gradual graded exercise. See a physiotherapist or your family physician for more advice and more personalized treatment approach, but generally it's something that tends to resolve well within a few weeks. Let me know what you've thought about this video. Have you had costochondritis, or are you struggling with costochondritis right now? Let me know in the comments below. Let me know your story, and look forward to hearing from you. Until then, we'll see you in the next video. Thanks for watching, and take care.